Craniopharyngioma. Craniopharyngioma is a supratentorial mass that is a benign tumor in a child or young adult. This is the tentorium cerebri. The tumors which are above the tentorium cerebri are called supratentorial tumors, and the tumors which are below the tentorium cerebri are called infratentorial tumors. So craniopharyngioma is a supratentorial mass or tumor, and this is a benign tumor. It usually arises in the children or in young adults. Most of the children tumors are infratentorial, but this is an exception. The craniopharyngioma is a supratentorial tumor in the children. They are derived from the epithelial remnants of Redke's pouch, and these remnants of Redke's pouch give rise to the tumor which is called a craniopharyngioma. Over here you can see this is the floor of the mouth, and this is the base of the brain. From the floor of the mouth, Redke's pouch arises, and with the time it dissociates its connection with the floor of the mouth and migrates over there and forms a anterior pituitary. While from the base of the brain, the posterior pituitary arises. Whenever there are remnants, like you can see over here, whenever there are remnants of these Redke's pouch, so they may give rise to the tumor, which is called a craniopharyngioma. The presentation of the patient will be, first of all, it would be a child or young adult, and it will be with bitemporal hemianopsia. And this bitemporal hemianopsia is due to the compression of the optic chiasm. Over here, you can see that this is the pituitary gland. Above it is the optic chiasm. This is the optic chiasm. Whenever a tumor arises over here, it will compress this optic chiasm, and it will cause a bitemporal hemianopsia. Over here, you can see that this is the optic chiasm. Whenever these fibers are damaged, so it would cause the bitemporal hemianopsia. These are the neurofibers. That is, the visual fields will be from the temporal side, and the fibers affected will be the nasal fibers. Over here, you can also see that the temporal side visual field will be affected, and the fibers which are affected are the nasal fibers. So, in a nutshell, there will be bitemporal hemianopsia in a child or young adult because of the compression of the optic chiasm in the craniopharyngioma. In imaging, with what you will see calcifications, and over here it is shown that these are the calcifications in child which are having the craniopharyngioma. So this is a typical diagnostic picture of the craniopharyngioma. The craniopharyngioma tends to reoccur after resection. Whenever it is resected, so it may reoccur. So that's all for the craniopharyngioma. For other videos, please stay tuned with us. Thank you.